We treated Lynn for approximately 15 minutes, and I'm testing now posterior force transmission through the ilium, and you can see that I can load it to a point where the slack is taken out of proximal structures and I can induce additional mobility. And palpating the ASIS and the PSIS, noteworthy is that I can find the PSIS now distinctly below the belt line. And so bringing it this way and then doing an approximated angle that looks much more like a 30-degree angle. And it's distinctly below the belt line. So your posture has, in my opinion, changed. And there's a lot of controversy out there. Can we change posture? Can we not? And we can't change a person's innate posture readily, but if their posture deviates from their norm, in which there's a loss of mobility that coexists, then restoring normative mobility may in fact alter their posture back towards their norm. Okay? So let's have you lie on your stomach. And now taking up the slack in an inferior direction. You can see that I can actually take up the slack now. And yes, there is some force transmission. The sacrotuberous ligament I can now indent that. So it's not as rigid as it was before. Looking at inferior glide of the sacrum, I can take up the slack. It takes up rather quickly, and after that I'm really not able to get any force transmission. And so that predicts that the same effect will be present with regards to backward bending of the sacrum, or backward bending mobility or force transmission through the sacrum, if you want to say it that way. And so I can't even take up the slack, so that is unchanged. And I'm going to test a lateral mobility test through the ilia, and there's no give there in that direction. So there still is a lack of transverse plane mobility through both ilia, and there's a lack of mobility, force transmission through the lower sacrum. I'm going to take a quick look at L5, and then we'll have you walk. Okay. I can take up the slack through 5, which I couldn't do before, and I can induce some mobility through that. So that's encouraging. There is a pattern in the transverse plane, and we treated you for just 2 minutes, and I think what I'll do is I'll go back and retreat that for 5 and see if we can make a difference. But for now, let's just have you get up and walk down the hall. And go ahead.
More upright.
Do you?
Yes.
Interesting.
More upright.
Good, good. And go again. You know what I fail to do is to measure your height. I have this, nice setup over there, and I forget every single time. Treated a 62-year-old male. And go ahead and come back in. Do you feel any difference in mobility? Let's go one more time, actually. And I'm going to stop focusing on the camera, and I'm just going to watch you. I think I'm seeing some side to side, some lateral pelvic mobility.
You might be moving forward more on the left here.
Oh, yeah?
Seems like that felt very tight before.
I think I see a hint of transverse plane mobility in the pelvis. So you feel more upright.
Yeah, definitely feel more upright.
Interesting. Okay, so I'll stop filming now, and we'll see if we can gain a little bit more transverse mobility. Thanks.
Yeah, it seems like before.